Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Symptoms of pelvic inflammatory disease. In pelvic inflammatory disease, most common symptom is pain in the lower abdomen, which is bilaterally seen, which worsens after coitus and it increases after menses. There is there is mucopurulent discharge is seen after microscopy. If there is mucopurulent discharge, then we should advise microscopy. Intermenstrual bleeding is seen, and there is increased urinary frequency, fever with chills and rigors, with nausea, vomiting, and dysmenorrhea is seen.
thank you and thank you for watching.